A situation on the ground right there. The rescue is also filled with grueling physical and psychological challenges. Joining me now is Dr. Darria Gillespie. Doctor, the remaining boys have been trapped in this cave for 15 days. What are some of your immediate concerns?
So, hi, Joe. Good to see you. Yes, one of the things we're worried about with these boys right now is oxygen levels. They've talked about their oxygen level in that cave being 15% or lower. That's one of the very biggest concerns we have right now, but also dehydration and malnourishment, and even things like hypothermia or infections.
All right. So, is it possible some of these boys may have real difficulty, not be strong enough to make this journey back out of the cave?
Joe, that is always a concern with anyone, but I've seen from my own patients, I am always impressed by how strong people may be. But they're going to have to do things to really prepare them. But again, time is not on our side. So what the rescuers are doing, I'm sure, is they're doing as quickly as they can without rushing so much so that they endanger the operation prematurely.
Okay, so now let's talk just a little bit about mind-body science here. I don't know if you're a fan, but there is reporting now from multiple outlets that the coach with the kids inside was a Buddhist monk for something like a decade, and that he actively practiced meditation. Do you imagine that having that gift or that skill to work with these young boys on meditation might be one of the things that has kept them mentally centered, if you will?
Joe, I think that's an excellent point, and I absolutely think that there is a connection between our mind and our body and how it manifests itself, and for two reasons for these boys. One, even wherever you're trapped, when there is uncertainty, being able to control your emotions is going to be very important. For these boys who may be in a situation of low oxygen, which itself can cause sort of an emotional disturbance and panic and fatigue, and having to control their breathing through scuba diving to be rescued, being able to retain that calmness and set aside anxiety for these boys is going to be especially important.
Absolutely. Anxiety is everything. And there's also that issue of panic as you make the transit, certainly through the water, even with a diver in front and a diver in back.
Yes,
another question, I think, is about one of the boys actually having to be airlifted this morning, Eastern time. A lot of us watch it on TV very, very early. The hospital obviously was awaiting that young man. We do not know his condition, but does that give you pause about what kind of shape these kids are in as they're starting to come out of there?
Yes, and where there's impossible to predict what their shape will be. Airlifting is especially could be dangerous if somebody's just come from scuba, because they're now having very different pressures. But so if somebody does have to be airlifted, it really does make you wonder what resources did they need. But they really have to make sure that they stabilize that airway and that breathing and that circulation before they transport that child.
Absolutely, because there's that issue of getting nitrogen essentially in your joints and muscles. I believe they still call it the bins.
Yes.
Am I right?
Exactly,
Right.
exactly. When you cut from that partial pressure change from the oxygen and nitrogen and everything we're breathing into our bodies.
So what are the doctors looking for when these boys finally get out of there and arrive at the hospital? I guess you call it triage.
Yeah, so just like we do in the U.S., we have very extensive protocols for in complex cases like this, because you don't want to miss anything. So you go through the A, B, C, D. So the airway, they'll check that first. Breathing will be an issue. We talked about oxygen, if they've had any inhalation or respiratory injuries during this time. And then circulation, dehydration. Are their blood acid levels higher because of carbon dioxide and from some sort of starving and ketoacidosis? They'll be checking all of those things. Will be very crucial in the first half hour to an hour, and then stabilizing them over time.
And there's obviously the psychological aspect of this. We talked in the last hour to a doctor who dealt with the miners in Chile in 2010 who says some of them are still feeling the psychological aspects of having been underground for so long. So there's the short term and the long term. What are you looking for? Short short term about the mental state.
Joe, that's something we're going to be absolutely concerned about with these boys. And the consequences of it don't always emerge immediately, and they will be different for every child and teenager. So they're going to be looking for how they're feeling, how they are dealing with this. A lot of them may initially just be in shock and not really displaying really any emotion. So they'll be watching those children for weeks, if not months and longer. And I do think we have to mention, you know, as a mother myself, I don't think we can underestimate the impact on their parents as well. So they'll be needing to monitor them as well.
Absolutely. That's got to be quite a challenge, sitting around for that long waiting if your son's going to come back. Thank you for that, Dr. Darria Long Gillespie.
Thank you, Joe. Take care.